I have been practicing psychiatry for over 30 years. I was lucky to have made the choice to be a psychiatrist within the first 30 minutes of seeing a case of a young lady with somatization disorder. She underwent 2 unnecessary laparotomies because the doctors had ignored to pick up the psychological conflict and the borderline personality disorder. The way this case was formulated and managed by my teacher, Professor Malik H. Mubashir, touched my soul, and I chose this specialty instantly. It was, however, very difficult for my parents to accept my choice of subject and specialty. Through these years, I have been associated with teaching and training of the medical students. I've realized that they have a great interest in the subject, but somehow when it comes to choosing and making a final decision, they cannot make that. There is a degree of cognitive dissonance that these young boys have, and it is in this background that I decided to make this video. I'll try to do this by introducing and motivating the young medical doctors on the basis of the evidence that is available about the choice of the subject. I would want to decrease the stigma that is associated with this specialty. And finally, I'll leave you with the choices of training that exists in our country, Pakistan. Let me give you some stories to justify my objectives. My story number 1 is that of Shazia. She is a young lady of 25. She gave birth to her 4th daughter, and few days later, she started to behave oddly. She was not able to eat, sleep, look at the responsibilities at home as a mother, as a wife, and was unable to function normal functioning that she had been doing over the years. She suffered from major depressive disorder. By year 2020, depression would become the second most important cause after cardiovascular diseases in terms of the disability and burden it produces on the patient and families. The epidemiological studies carried out in Pakistan indicate that women suffer between 30 to 60% and men from 10 to 25% in our country. The studies that we have carried out at the Institute of Psychiatry indicate that 25% of women in gynae wards suffer from postnatal depression. Sadly, none of this is recognized and treatment is never considered. Suicide is one of the complications of this disorder, and for every completed suicide, there are many more people who make an attempt to kill themselves. My second story is of Asad, who is 20 years of age. He started to believe that his family and friends are against him. They are plotting to kill him. And he also believed that they are poisoning him and they want to kill him at any cost. He reported that he was hearing voices of religious scholars who were telling him that he was bad and he should be punished and he should be killed. He became very fearful and apprehensive. He stopped going out and isolated himself into his room for about 6 months. He wouldn't allow any family members to come in and would not eat or drink. This is a story of psychosis. Mostly it begins as a schizophrenic psychosis, or it can be a bipolar mood disorder. 60% of these patients in our country do not get recognized, do not get adequate treatment. The important thing that we have to note here is that these disorders have to be recognized early, treated early. The longer the delay, the bigger the deficits and bigger the damage to the brain that it causes. Every year in Institute of Psychiatry, 9% of our admissions are because of this disorder. My third story deals with how young boys and girls deal with stress in our society. Aisha was a brilliant student at 20 years of age. A month ago, her parents got her engaged. A week before her examination, she began to develop abnormal symptoms. She was not able to sleep, behave very oddly. At times, she would run up in the middle of the night, leave home, and would wander around in the streets. She started to speak in a very different language that the family had never recognized. She started to throw things at abnormal places, and her family and everybody else believed that she was suffering from jinn, jadoo or taweez. That began the journey of her family seeking help from various sources. She was taken to multiple spiritual and faith healers. Oftentimes, she was subjected to barbaric treatments that are very difficult to bear and describe. This young lady suffered from dissociation disorder. Every year, in Institute of Psychiatry, 10 to 15% of these patients are admitted in the indoor settings, and equal number are seen in the outdoor settings of the institute. My next story is about Ashraf. He brought his 65-year-old father, who had retired as a school teacher with a meritorious work record. Ashraf reported that his father had started to behave differently for last few months. There was a change in his personality. He was not able to recognize his family members. He was forgetful, and he would put things and would ask people where he has put them. Oftentimes, after having his dinner, he wanted to have another dinner because he had forgotten. He would not know where his bathrooms are in the house and where other rooms are in the house. He became incontinent of urine, and at times his behavior became very embarrassing for the family. This is a typical story of dementia. Dementia is a disease of old age. 6.5% of our population is above 60 years of age. And they're beginning to have this disorder, which is oftentimes not recognized and not treated. Healthcare providers are unaware of its existence and the burden that it poses on the patient and the carer who look after them. Around the world, there are 45 million people who suffer from dementia. My next story is a very tragic story. This relates to Qasim, who is an 18 years old A-level student. He was doing brilliantly in his studies and in his athletic activities. He was the star in his college. He had friends and he was first in studies. 3 weeks before, he became subjected to using hard and soft drugs. And over a period of time, his behavior deteriorated and all his brilliance got converted into a junkie who was worth nothing. In Pakistan, 4 million people suffer from substance use disorder. This is a disorder which has very close associations with medical complications, social complications, emotional complications, and the abuse of human rights are violated grossly in this kind of disorder. There are no checks and balances that are existing in our country. World over, evidence-based treatments are available, but sadly, we are denying our young population the treatment that can save them. My next story is about Hussein, who is a 13-year-old young boy. He comes from a family which is very well educated and very well placed in society. The parents noticed that after his birth, he started to talk late, and despite that, he talks very little. He sits in one particular corner of his house, plays with one toy, doesn't want to make friends, doesn't interact with anybody, and he has his own favorites and not so favorite things. He goes to school but has difficulties in most subjects. Although he's very good in sketching and he can sketch anything that you show him, anything that he wants to the perfection. He is oftentimes ridiculed by his teachers, by his colleagues in the class, and by his family members who think that this boy intentionally is not studying other subjects. He suffers from autism spectrum disorder. One half of the mental illnesses begin before the age of 14 and 75% begin before the age of 24. Human mind develops before birth and immediately after birth. This is the time where children are developing their confidence, their self-worth, their ability to deal with stress. Their personalities are being formed. their level of emotional and intelligence quotients are being developed. This is a very critical time for the children. If we miss this opportunity for their learning at this point, this is something, an opportunity which once missed will never be able to taken back. Sadly, this important part of the story has a very difficult ending in our country. There aren't any child psychiatrists who can deal and who can pick up these disorders early. College of Physicians and Surgeons is now working very fast on introducing the second fellowship in child psychiatry. My final narrative is about a 48-year-old lady by the name of Afsha. She had been suffering from diabetes and hypertension. 6 months ago, the physicians were able to make her the diagnosis of hepatitis C. After all the required investigations, she was commenced on interferon treatment. 4 weeks into the interferon treatment, she began to behave abnormally. She was aggressive, abusive, running out of the house, calling names to every family member, refused to have any kind of treatment, and she made an attempt to jump from the 4th floor of her newly constructed house. This is an interface between medical and psychiatric disorders. And that's the name of the game, where expert psychiatric treatment is absolutely necessary and mandatory, because if medical and psychiatric disorders coexist, the treatment and the prognosis of both these conditions is interdependent. If you don't treat one disorder, the other disorder becomes bad. And for these reasons, people have done lots of studies which indicate the coexistence between depression and psychiatric disorders often impairs the adherence to the treatment. It leads to complications of different kinds in both the disorders. The general health condition with both these disorders deteriorates. The treatment adherence becomes very important, and it is for that reason we think that treatment of depression has to be recognized by the physicians who can make an early diagnosis, early treatment, so that their conditions can be both matched and treated appropriately. There is research evidence which is available indicating that incidence of depression after myocardial infarction is of very great significance. Around 15 to 20% of people in the first month after myocardial infarction would develop depression. Prognostic studies would indicate very clearly that the mortality and the recovery depends on the treatment of depression. If depression is not treated, all kinds of mortality after myocardial infarction are increased. The stories that I have shared with you give you the flavor of the clinical practice of psychiatry in a fascinating way. There is another component that you need to remember: research. Psychiatry provides you with an opportunity of doing groundbreaking research. The research agenda can be very wide. It could range from research in a laboratory looking at the epigenetics, or it can be testing psychosocial interventions in a community-based settings. You can be conducting multi-site, multi-arm, randomized controlled trials and getting them published in high-impact journals locally and internationally. Indeed, many of our colleagues have done their PhDs, and that has provided them with an opportunity to rub their shoulders with the academia of the world, thereby creating the name of their research at a very high level. The narratives that I have shared indicate a very big magnitude of the problem of colossal nature. We think that there is no health without mental health, and mental health is real wealth. Let me take a minute in the background of these narratives to share with you some of the myths that people hold about psychiatry. They think that psychiatric disorders are no disorders. They are actually the cause of bad behavior that people bring on themselves. They also believe that a child can never be depressed, and for an elderly population, it is normal to be depressed. They think that people who have psychiatric disorders are evil, they are sinful, they are violent, they are criminals, and they cannot be helped. Any serious mental health problem cannot be treated. And finally, society, medical profession has a big stigma against psychiatrists. They think that psychiatrists themselves are mad. And when you hold such kind of opinion about your fellow colleagues, the stigma increases beyond control. There is enough evidence that psychiatric disorders like medical disorders can be recognized, can be treated, and the functionality of the individuals can be restored just like physical disorders. The narratives on one side and the myths on the opposite side. What solution we have for the fast-growing population of our country? 192 million people at this point. There are only 320 psychiatrists available within the country. If you extrapolate, that would mean that one psychiatrist has to see 115,000 patients of depression, 8,000 patients of bipolar mood disorder, 4,000 patients of substance use. This is colossal problem. If we want to give our population a better mental health care, one psychiatrist for a 20,000 population is recommended. That gives us a colossal figure of 9,600 psychiatrists to be produced in this country to give better mental health services. For over 50 years, College of Physicians and Surgeons, Pakistan has been providing postgraduate education in this country. This is one of our prized institutions in the country, and this has won accolades from all over the world. At the moment, college provides fellowships and memberships in various disciplines of medical and surgical specialties. To date, there are 246 fellows in psychiatry and 233 members of the College of Physicians and Surgeons. We have 160 postgraduate trainees registered in the residency training program of the College of Physicians and Surgeons. On an average, we produce about 20 psychiatrists in a year. It is this gap which is very important for us. I want more number of people coming into the training programs of psychiatry of College of Physicians and Surgeons.
The College of Physicians and Surgeons came into being about more than 55 years, and since last 30 years, Alhamdulillah, the college is producing psychiatrists. Among others, 73 specialties in which doctors they are doing post-graduation. By the grace of God, CPSP has produced more than 250 psychiatrists, and their fellows, and the same number, almost the same number, members they have been produced by the college. Most of them are working in Pakistan, but they are also working in Middle East countries and in European countries. And CPSP really takes pride of all these things. And personally, I am indebted to all my fellow colleagues, psychiatrists, who on my insistence and on my request, they created a new specialty in the psychiatric field, that was the child psychiatry. Because I, as a practicing physician, did feel the deficiency of this group of patients who were coming from us from pediatric to adult age group, and they were having various type of psychiatric problems. For undergraduate medical students, Alhamdulillah, by the hectic effort of the Faculty of Psychiatry, they started introducing the behavior sciences subject, and I think that has done a really very good impact on the students. And now medical students move in third year, fourth year and final year in their rotation to psychiatry wards, and they get quite good information about these very important specialties. And I, as a professor of medicine, do tell to all of my students that if you know the psychiatry, you can become a good gynecologist or a physician or a surgeon or go to any specialty. So in the undergraduate training, I think the role of psychiatry is much more important than as was thought in last decade.
There are 160 registered postgraduate trainees in the training programs of the college. On an average, every year, the college produces about 20 psychiatrists. This is a very small number, and this is the number which I want to increase, expand, and enlarge. And that is where I'm addressing you to come in and look at the problems that this country faces. Let me take you through the training opportunities of the fellowship and the membership of the College of Physicians and Surgeons. After you complete your house job, you will have to take Part 1 examination in psychiatry. Once you pass the Part 1 examination, you would enter into a structured training program lasting 4 years. At the end of the 2 years, you will take an examination which we call as intermediate module examination. During this time, you will have to prepare a research dissertation on the topic of your choice, approved by the supervisor supervising you at that point. Another 2 years of training, you are eligible to appear in Part 2 of FCPS. Remember, this is an exit exam. Once you have qualified for your fellowship, you are allowed to compete and work within the country as an independent consultant. Your training will expose you to theoretical bases of psychology, anatomy, physiology, and the clinical subjects that are very common in psychiatric practice. The exams are designed to be candidate-friendly and are very transparent exams. Once the exams are done, you are eligible to apply and compete for the highest posts that the country offers. Those of you who would follow the course for the MCPS, your courses are much simpler and shorter than the fellowship programs. The duration of the MCPS training is about 2 years, and this exposes you to common mental health problems, their recognition, and their treatments. There is no research dissertation that you have to do for your MCPS examination. The details of these programs is available on the college website, and the reference of that will appear at the end of this video. Young boys and girls, I am so pleased that I chose the subject of speciality. For my parents, the initial reaction of shock, disbelief, and anger turned into a source of pride and satisfaction over the years as they've watched me grow, glow, serve, and achieve what I've been able to achieve in these last 30 years. My message to you is to come and join us for looking after the mental health care of the people of Pakistan. And there are training opportunities available that will take you to places within the country and elsewhere. I want you to join us and help us to look after the needs that are waiting for us for a very long period of time. I hope this serves as a leap and not a step forward. Leaders become great not because of their power, but because of their ability to empower others. Thank you very much.